Hello and welcome to the Better Man Clinics, the podcast where we talk to actual experts to address the questions the men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They do not represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope that the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. Now, with that being said, in this episode, we discuss high blood pressure. Did you know that 50% of men in the United States have high blood pressure? That's right, half of all men in the US. But why is that important? Well, high blood pressure can increase your risk of heart attack and stroke, while also possibly leading to kidney failure, vision loss, and dementia. And if that wasn't concerning in and of itself, most people with high blood pressure don't even know they have it. So how can we tell if we have high blood pressure? What can we do to prevent it? And if we do have it, what can we do to treat it and prevent its potentially very serious consequences? Fortunately, to help us answer these questions, we are joined by a true expert. Dr. John Erwin is a general cardiologist and the clinical chair of the Department of Medicine at North Shore University Health System, an affiliated program of the University of Chicago College of Medicine. He formerly served as a senior staff cardiologist and professor and chair in the Department of Internal Medicine at the Baylor Scott and White Health Texas A&M College of Medicine. Dr. Erwin completed his residency and cardiovascular fellowship at the Mayo Clinic and a level 2 fellowship in cardiac CT angiography at the Princeton Longevity Center. In addition to clinical practice, he serves on the North Shore University Health System Board of Directors. And now, I bring you our conversation with Dr. John Erwin about high blood pressure. Hello, and welcome to Better Man Clinics. Today, we're going to be talking about hypertension, or as most of us refer to it, high blood pressure. Now, we've all gone to the doctor's office and they put that funny cuff on our arm and blew it up and told us our blood pressure. But what does that blood pressure really mean? I mean, the doctor tells us we have to keep it at a certain level, but why? What happens if we don't? And can we do anything proactively to keep it at a good level? And for that matter, if we already are told we have high blood pressure, can we change things in our diet or our lifestyle that might make it better? And frankly, when is it time to really see the doctor about blood pressure problems? Fortunately, to answer these questions, we are joined today by a true expert. Dr. John Erwin is not only a board certified and licensed cardiologist, he's also a real expert on this issue. And we really value his insight to really give us an understanding of what this whole blood pressure situation is. So Dr. Erwin, welcome to the program.
Glad to be here. Thanks for inviting.
Thank you. Before we jump into blood pressure, one thing I love for the guys that are listening and watching to experience is get to know you a little bit better and away from the resume, but you as a person. I know that you have an interesting background in I think high school and college football, and that kind of also led you from there into the medical world. Kind of explain to us maybe a little bit about your journey and how you got to where you are now helping people as a cardiologist.
Yeah, sure thing. I grew up in Texas, where football is somewhat of a religion, and so I grew up all my life wanting to play for the Dallas Cowboys. And when I went to college, I thought, well, I got a scholarship to a Division I school, and there still may be a chance. And then I played my first play of college football and realized I better start on plan B. And plan B was to be a physician.
That's awesome.
I did play 4 years, but I was a very average to below average college football player. And so medicine was my plan B.
Nice. And what made you decide to go into cardiology?
Just really love the field. I actually, when I went to medical school, I was thinking I wanted to do orthopedic surgery, but when I actually got into it, I found it to be a little dull for me. I liked doing procedures with my hands, but I also like doing the medical part of it and the other cognitive part of it too. So it was it just pieced everything together really well for me. And I don't think I've ever had another same situation as I did running out of the tunnel in college, as I did taking care of somebody having a heart attack coming into the ER. I feel the exact same way.
Well, that's really awesome. I'm sure that's very rewarding work, and your patients are lucky to have you. And with that, that's actually a good segue, right? Avoiding that trip to the emergency room with a heart attack or a stroke or other issues. And that's kind of what our topic du jour today is, which is blood pressure. So we're gonna do what one of my classmates in medical schools always did. I sat in the very back row and he sat in the second row. And before every lecture in the middle, he'd raise his hand and he'd say, "Professor, I just need you to tell me the basics, okay? Just the basics. Let's not go crazy here, just the basics." So we're gonna start with the basics too, and we're gonna ask a really simple question. What the heck is blood pressure anyway?
I think the simple way to think about it, it's just simply the pressure of the blood that's pushing against the walls of our arteries.
Mm-hmm. Got it. Well, that's pretty simple. Now, with that being said, whenever we get our blood pressure checked, we get two numbers, a top and a bottom. What do they mean? Is one more important than another? How do we interpret that for better way of saying it?
That's a great question. Essentially, the top number is the amount of pressure that's in your arteries when your heart is contracting, when the heart muscle is squeezing. And that's called the systolic pressure. That's the top number. The diastolic or bottom number is the pressure that is generated when our heart is actually relaxing and diastole. And so the normal pressure for the top number should be 120 or less, and the bottom number should be 80 or less.
Okay. And is one more important than another, or why do we need to know both, I guess?
Over the years, our thinking on this has evolved quite a lot. Many, many years ago, when I started training, they thought only the bottom number mattered, really. But we had a couple of studies that came out in the early mid-90s that showed clearly that both of those numbers matter. And so we really need to shoot for ideal goals of keeping our blood pressure around that 120/80 zone. We know that for every few points that it goes up above that, whether it's the top number or the bottom number, our risk of some of the bad things that can happen from the blood pressure being high increase dramatically.
Got it. No, and that's a very important point. And another perfect segue is most guys will listen to it. Now I say, "Dr. Erwin, this is all good. Listen, we'll all shoot for 120/80, but how bad is it going to be? Like, what is this blood pressure even? If I never control my blood pressure, what's the worst that can happen, right?"
Yeah, and unfortunately, there are a lot of bad things that can happen. For those of us that are old enough to have grown up in the 70s, you remember that the commercials that used to come on TV was about blood pressure being the silent killer. Because quite honestly, we don't have a lot of symptoms until the blood pressure is extremely high. And even just mild to moderate elevation of the blood pressure significantly increases our chance of heart attack, of stroke, of aneurysms, of heart failure, kidney failure, dementia, vision loss, and loss of sexual function.
But other than that, it's not harmful at all. Aside from those minor issues, it's pretty mellow type of issue. So I mean, it sounds like I guess it kind of makes sense, right? The blood circulates all around your body, and it impacts all these organs. So it would make sense that if it's not fine tuned, you're really taking a huge sledgehammer to your body across the board. And you also made a very good point of it being that silent disease, right? That nobody knows to even think about it because the inevitable, "I never felt anything." So, just to get an understanding of, risk, are there some people that are more prone to high blood pressure, maybe that they should have their antennas out a little bit earlier or a little bit more aggressively than others? Or is everyone pretty much equally susceptible?
It's a huge problem across the continuum, across the spectrum of our entire society. But clearly men have a higher risk of that. And what a lot of people don't realize is that the basic kind of high blood pressure that we call essential hypertension actually usually develops in our 20s. And unfortunately, most of us men don't go to the doctor except for when we've broken a bone or have something else that hurts us. And if the blood pressure is a little high, many times it gets written off that, well, that's your pain from your broken bone or from pulled muscle or whatever it may be. But we know that men are a little bit more prone to that. We also know that being Latinx and or Black background tends to have a higher risk of developing hypertension and more severe hypertension. But really all of us are at risk, especially those of us that may carry a few more pounds than what we should.
Got it. So weight as well. But it sounds like pretty much everybody should be, getting checked. Probably the earlier the better. Is that right?
Yeah, I really think that's one component that an annual exam may be important to have. And so obviously checking at an annual exam, but it's not a bad idea to have a blood pressure cuff in each of our homes, or at least check into a pharmacy periodically and use one of the machines that they may have there just to get a gauge of where you're running. Got it.
No, that's a great idea. I mean, it's very accessible, right? Any local pharmacy, you can get your blood pressure checked. Now, with that being said, even if we before we're checking, right? If we want to say, okay, you know what, I want to go with a clean slate and I want to try to maximize the chance of not having a high blood pressure. First of all, diet. What impact does diet have on my blood pressure on a daily basis?
Diet really does have a huge impact on it, not only from the standpoint of taking in excess calories that make us more prone to put on weight. The more weight we carry, generally the higher the blood pressure is going to be. Your body has to create more blood vessels to supply that extra fat. And when it does that, it's just more pressure that's required to circulate the blood through that. Beyond that, there are other components of the diet, such as sodium, which is general table salt. Most of us eat too much of that. It's recommended that we keep that less than 2 grams a day, but the average American is going to eat 6 to 8 grams of sodium a day, unfortunately. So we have a lot of work to do in that, because many times, even if we're not using the salt shaker, anything that we buy that's prepackaged in a bag or a can or anything like that typically has a lot of salt in it to help preserve that. Beyond that, excess alcohol if you're drinking more than a moderate amount of alcohol, it will raise the blood pressure. We do know that there are ways that we can actually lower the blood pressure with our diet, though, if we generally stick with leaner cuts of protein and lots of vegetables and fruits. There's actually a diet called the DASH diet, DASH, Dietary Approaches to Stop Hypertension. And that diet actually can lower the blood pressure as much as a single blood pressure agent can.
Oh, wow. And again, those are the things that you mentioned, kind of low salt, low alcohol, moderate lean protein, that kind of stuff, right?
And a little bit more potassium salt in the diet. So that's one of the other things that we've seen, is that higher intakes of potassium in the diet tend to lower the blood pressure a bit as well.
Why is that?
It's a good question, but part of it is in the chemistry of how the blood vessels relax. And if we've got a balance that's out of kilter in terms of more sodium and less potassium, it affects the way that our blood vessels are either constricted or relaxed.
Got it. Now, you mentioned alcohol. Whenever we talk about really almost any disease process, we also talk about smoking. Does smoking have an impact on your blood pressure as well?
Absolutely does, yes. Even smoking a single cigarette a day is enough to raise the blood pressure significantly, because it causes those blood vessels to constrict, and that will raise the blood pressure.
Now, one thing we talk about our lifestyle, right? Everyone will say, listen, relax, you're raising your blood pressure, you're stressing out too much. Now, is that kind of more of an old wives' tale, or does, the more stressful of a life you have, the more chance you will have high blood pressure?
Now, it's very clear that stress does play a role. If one checks your blood pressure as you've been given a complex math equation to solve, we see the blood pressure go up. Even in somebody that's good at math, it'll go up some. So stress definitely plays a role, and being mindful of the degree of stress that you're dealing with at any given time is important. We've seen that even meditative type strategies can be helpful in lowering blood pressure, or taking slow, deep, relaxing breaths in and out actually can lower blood pressure. There's actually a device that people can wear that can train them to take slow, deep breaths, and it too can lower the blood pressure as much as a single blood pressure agent can.
Got it. So, I mean, it sounds like there's a lot of dietary and lifestyle issues that we can address. I'm gonna return to that in just a little bit in terms of active. Once you know you have high blood pressure, what to do. But I want to go back to symptoms, right? And you had mentioned that from the 70s, that's kind of one of those silent diseases. You don't feel much. I think it's worth reinforcing. A, do you feel anything? And B, you had mentioned until things get really bad. So what are those red flag signs where you say, you know what, now I'm in some trouble. I really need to get medical attention when it comes to blood pressure?
Yeah, again, most of those things are going to occur when it is really, really high, and even lesser amounts than that, the damage can be occurring. But if one were to suddenly lose the ability to either feel one side of the body or the other, one side of their face or the other, or lose obviously muscle function on one side of the body or the other, that would certainly be a high red flag that would come up. Chest pain, chest heaviness, or significant shortness of breath for no good reason may be some signs related to that. There are some people who I think do get a headache at higher levels of blood pressure, but for most people, again, it's a very high level of blood pressure. You can have sudden vision loss in one eye or the other, can be a manifestation of significantly elevated blood pressure. And then even confusion, sudden confusion, personality changes, difficulty concentrating, irritability, or progressive sort of faintness, loss of consciousness can be some of those red flags too.
Got it. And that's a lot of those sound like it's not just a manifestation of the blood pressure itself, but the issues that the blood pressure could be causing to other organs basically as well, right?
Absolutely. It goes all the way back to those things that we talked about with stroke and heart attack and heart failure and all those bad things that we were mentioning earlier.
Got it. So let's give you a scenario now. So you know what? I'm taking your advice. Maybe I'm in my 30s or my 40s, or frankly, even in my 20s. And I happen to be at the local drugstore just picking up some things, and I see that automatic blood pressure cuff, right? And I go and I say, you know what? Dr. Erwin said I should get checked. What's it going to hurt? And I check it, and it's a little bit elevated. Maybe it's, I don't know, we'll call it 145/85, right? So it's not like through the roof or anything, just a little bit elevated. What do I do in that situation as a otherwise healthy guy? Maybe I'm in my 30s.
Great question. I think it's a common issue that people deal with as well. So just to say that anything over 140 for that top number is actually considered stage 2 hypertension. So it's high blood pressure. Now, with that being said, machine calibration in the pharmacy may be off. It may not be adequately controlled. There are other things that we know that we need to do to get the blood pressure taken in an accurate way. You shouldn't have had caffeine within the last half hour. You shouldn't have done any significant stressful exertional kinds of activities within the last 15 minutes prior to that. And then it's also important that you have the proper size cuff and that you're seated in the right way with the arm at heart level. And so there are things that can make it higher than what it really is. And so I would say if that were to occur to someone, they should get in and see their doctor, let them check it the right way. And then maybe the recommendation would be that you buy a blood pressure cuff to have at home. They're relatively inexpensive these days, and many times it's helpful to have serial or several different points on the map to determine whether the blood pressure is really significantly and sustainably high, or was that just a one-off? And it's a potential that it could be a one-off.
Got it. So if I'm reading you correctly, these blood pressure measurements that we're taking, again, just for our own benefit, we're not at the doctor's office, we're not in a controlled setting. We just happen to get a check. We shouldn't really necessarily act on any of those numbers, aside from potentially seeking a healthcare professional to see, okay, what's the next step in that situation?
Absolutely. That would be the next best step.
Got it. Got it. No, that makes sense. So, let's say, okay, for the sake of discussion, now I made an appointment with the doctor. Now, this is where guys get antsy very quickly. We're going to go see a doctor. Instantly, the antenna goes up. What does that mean, right? So, what should a guy expect when they come see you? Again, the same scenario. I went to CVS. Maybe my blood pressure a little bit elevated. Maybe you even confirmed it that it is elevated. What would I expect in terms of evaluation, in terms of examination, other tests I might have to go through? What's the usual protocol for a guy coming in for high blood pressure?
Yeah, so the first step is always just with your healthcare clinician, just getting a little bit more history around what's been going on. Asking you about some of the symptoms that may or may not have occurred, asking you a little bit about your family history, asking you about your exercise regimen, your diet, whether you smoke or not. They would talk to you about your alcohol intake, and it's good to be honest with them. We know that most patients don't tell us how much they drink, but it's worthwhile letting your doctor know how much you drink. Beyond that, then a physical examination. They'll check your blood pressure again after you've rested quietly for a bit, and do it with a proper size cuff and in the proper positioning so that they can make sure that they get an accurate assessment. Beyond that too, a physical exam. Listen to your heart and lungs, feel your pulses, maybe listen over several pulse places in your body. And then it's also important that they take a look in your eyes, because the blood vessels in the back of your eyes can tell us a lot about what the chronic state of the blood pressure may be.
Got it. So it sounds like a pretty comprehensive exam that you're going through. Are any blood tests usually required?
Most of the time, blood tests won't be necessary in that situation, although many times your doctor may check your blood electrolytes, and that being predominantly your sodium and your potassium and your calcium levels. And then many times too, because the blood pressure can affect the kidneys, they may get a blood test that would tell us about the level of the kidney function.
Got it. And any imaging required, any x-rays or anything like that I should expect?
Generally not unless your doctor sees something or on physical examination, or hears something within the history that also raises other red flags. Would you need a more significant evaluation with imaging and a lot of testing and things of that nature? Most of the time they're gonna, if they find the blood pressure is high in the office, they're gonna advise that you get a cuff, follow it, and then give you some basic starter things that we should do in terms of lifestyle to see if we can get that blood pressure under control with lifestyle.
So I think that's a great point with lifestyle, right? So I want to dive into that and unpack that a little bit more. It's really easy to say, lose some weight, stop smoking, drink more reasonably, walk around a little bit. But can we dive in with a little bit more detail? Because the problem is that guys face, it becomes overwhelming, right? Like if you sit down and you're just told all those things, they're like, yeah, okay, it's just too much, and like, where do I even begin? So if you had somebody who is, I guess, comes in and they have a mild to moderate high blood pressure that you don't think they require medical intervention just quite yet, can you walk us through like a reasonable path, like tangible, like what can guys do that can improve their blood pressure over time?
Yeah, so if you're carrying more weight, then clearly trying to cut your calories down a little bit in your diet. And again, that DASH diet, DASH diet, is found anywhere online. And so it's actually a fairly simple thing to follow. It's got a lot more vegetables and fruits, a lot less prepared meats, a lot more lean protein sources. That's going to be step one. Step two, and in hand with the other, would be things such as just taking a walk every day. We know that walking is great exercise, and so we do know that if walking is going to be the preferred route of exercise, that you probably need to get somewhere between 40 and 60 minutes of walking 6 days a week to do that. You can also do more high intensity interval training on fewer days a week and do those for about 20 minutes. But again, some of that depends on what your level of conditioning is, and many times you have to walk before you can run and get to those other types of activities. And then, your doctor's gonna, depending on what your weight is and some of this other history, if it still remains elevated, they may look at some other potential causes of high blood pressure. There are things that we call secondary causes of hypertension that if the blood pressure is staying up despite that, we may need to do a little further assessment. One of the more common things that can cause daytime blood pressure elevation is obstructive sleep apnea. So if your doctor gets the history that you're a snorer, that you're a restless sleeper, or that even though you think you may have gotten an adequate number of hours of sleep during the nighttime, you're still sleepy during the day and you fall asleep every time you sit down, that may be a marker to your doc that there may be some other things that they need to look into.
Yeah, that sleep apnea point is an important one. We had another doctor on to talk about that. And, you think everyone makes fun of snoring, right? But if you think about the level of underlying health concerns that potential quote unquote snoring could be hiding, it's quite remarkable. A few follow-up questions in terms of diet and lifestyle. First one, in terms of weight loss, is there a magic number there? Like, should they be goal like, oh, you know what, I got to drop 10 pounds? Or is it just kind of more a continuum?
It is a continuum, but what I tell people is we have to be reasonable and rational about what can be done. Weight loss, quite honestly, is a difficult thing. Having been a 320-pound offensive lineman at one point in my life, I can tell you I can empathize with that. And so utilizing professionals to help with weight loss can be important if you have the means. If the means are not there, there are simple things like Weight Watchers that can be done, relatively simple, and keeping a diary of the foods that one eats can actually be extremely helpful, because many times people don't realize, yeah, I did have that snack in between meals every time, and that may be an additional 200 or 300 calories. People don't have to eat a whole lot of extra to gain weight. Usually, if you eat 150 calories a day more than what you burn off, you're going to gain 15 pounds in a year. And so it really doesn't take much extra to make that happen. If you eat a couple of peppermint candies after your lunch so your breath doesn't smell bad, that can be a lot of calories in those little things. And so having people kind of journal what they eat, and there are lots of apps right now that you can put on your phone that make it really easy to journal what you're eating. And so I encourage people to start with that.
Got it. I mean, that's such an important point. I mean, do you think, and I'm going to put you on the spot here, do you think that most doctors, when they are faced with kind of a patient with high blood pressure, that they focus as much on weight loss? Because I know the knee jerk is always salt, right? Low salt diet, low salt diet. And I know a lot of people who were put on that low salt diet and they're like, I don't need any salt. My blood pressure hasn't budged. Do you think it's because those other factors are the ones that are kind of in play and it's not just the salt?
I do. I think it's that. And I think we all know how frustrating it is to try to lose weight. And I think many doctors feel that way too, because we know how many people that we advise and give our best advice that we can as to how to do that. And it's a frustrating thing for everyone. It's frustrating for the person that's being treated for the weight and the blood pressure. It's frustrating for the healthcare team because they clearly want to see success in seeing that blood pressure come down and seeing that weight come off. But in general, for every 10 pounds of weight one loses, they can also drop their blood pressure by 10 points. So it is a continuum, but even 10 pounds can be enough to significantly lower somebody's blood pressure to the point that they may not need medication.
Well, that's pretty compelling, that's for sure. And again, that weight loss part is huge across the board. One more also follow-up question about the exercise part. One thing I don't know if it's a myth or a reality that's promulgated a lot is if you have high blood pressure, you should avoid any type of resistant exercise, because as you're doing resistance exercises, your blood pressure might go up and you might give yourself a stroke or something like that. What are your thoughts on that?
I'm a real healthy enthusiast as it pertains to resistance training. I think it's a key part of what we do, no matter what your blood pressure is. Now, there's certain medical conditions where people probably shouldn't do a lot of heavy lifting, but one can still do toning exercises even in that situation. But we know that while the blood pressure goes up as we exercise, and it does that when we walk or run or do aerobic activity too, But when we stop that exercise, our blood vessels dilate. And so what happens after that exercise period is the blood pressure actually drops and stays sustainably lower for many, many hours after that exercise session is completed, whether that be resistance training or aerobic activity.
Got it. So, I mean, so again, as long as you're not, just to reiterate, as long as you're not lifting massive amounts and kind of, squatting your car, generally speaking, it should be okay. Obviously, we're going to throw out the caveat here. Always check with your doctor before, starting any kind of exercise regimen for obvious reasons. But at least we know, as a general principle, you don't have to cut out, all the maybe resistance exercises that you enjoy in the gym that gets you going to the gym for sure.
Absolutely. And I'd also add one more point to that is that we know that as we gain muscle mass, we actually burn calories at a higher rate too. So it's very important in weight loss to do resistance training. You hear people say, well, I'll look fatter because my muscle's bigger underneath my fat, but that really isn't the case. And the more lean muscle mass that we can carry, the better. It's better for our bones. It's better for our general health, and it can help us to lose weight overall.
That's a great point, really. So that combination of aerobic and resistance exercises is one of the keys here, it sounds like. Now, let's continue our case study here, our scenario, right? So I did everything you asked me to do. I lost a little bit of weight, went on a diet. For the average person, I'm not sure you know the answer to this question, but for the average person, what percentage of them would successfully lower their blood pressure enough with just this regimen without having to go on medication?
There's a chance that up to, if those things were followed and if we lost weight and started activity, I would say that there are probably about 40 to 60% of people that with lifestyle management alone can get it down. The others are going to be destined to need a medication, I suspect.
Yeah, well, that's pretty reassuring. I mean, again, getting a 50-50 shot is as they said, I forgot for which movie. So you're saying there's a chance.
Right.
This is much better than that, let me tell you. So, and actually, before we go on to one other follow-up, how long does it take through, again, if we're going through diet and lifestyle, how long would you anticipate it would take to get your blood pressure down to an appreciable amount? Is this something that happens over a course of a week or months? What's that timeline look like?
It's going to generally take a minimum of 6 weeks. And, if we see somebody back in 6 weeks and the blood pressure is better, but still a little high, then we may say, let's keep at this. Let's see if we can do this. Depending on, whether there are other risk factors at play. One of the things I didn't mention earlier is that if there is a history of early heart disease in a primary relative, your doctor may check your cholesterol too. So if your blood pressure is high and your cholesterol is high, that's somewhat additive. So there may be a lower threshold at that point to maybe put somebody on medications.
Got it. So let's say I'm in that scenario, and you know what? I've given it a good try. It just, my blood pressure is not acceptably low, I guess. Medications. Can you give us a little bit of a primer on medications, like the type, not to go into tremendous detail, but like the types and kind of what they do to actually lower your blood pressure?
You bet. So one of the things with blood pressure medicines is they're basically two mechanisms that these what we call antihypertensives or blood pressure medicines come in. One of them is a water pill, which we also call a diuretic. The other are medicines that actually cause the blood vessels just to relax and to dilate so that they're not as constricted. And so we know that there's some regulatory changes that occur in the kidney in certain people that cause them to hang on to excess salt and fluid. And so diuretics or water pills tend to be a first-line blood pressure agent for most people. They tend to have the biggest bang for the buck in terms of reducing the blood pressure. And clearly, if there are more than two medicines that are required to get a blood pressure medicine down, a diuretic generally should be a part of that regimen. And I'll speak to that a little bit more later. But the other classes of medicines, they're called the ACE inhibitors or the angiotensin receptor blockers that actually work on a hormone that our adrenal glands secrete that make the blood vessels contract and constrict. And then we have classes that are called blockers, calcium channel blockers, beta blockers, and alpha blockers. And essentially, those act on the blood vessel wall themselves to cause the blood vessel to dilate and to relax, to allow the blood pressure to reduce. When it comes to medications, it's not uncommon that people are going to need more than one medicine to get their blood pressure under control. In most studies that we do, the average person that has moderate high blood pressure may need 2 to 3 medicines to get their blood pressure down. And we used to just take one medicine and crank it all the way up to the maximum dosage. And if that wasn't working, then we'd add another one and we crank that one up to the maximum dosage. There's been an increasing body of data that's shown us now that using small doses of several medications controls the blood pressure better with lower side effects from the medications. So we generally these days like to use a multi-drug regimen at low dose.
Well, that makes a lot of sense based on what you said, because it sounds like these 3 classes, the diuretics, the ACE inhibitors, and the broad bucket of blockers, they're all approaching the problem from a different perspective. They're hitting it with a different tool, if you will. So kind of on the layman's perspective, it makes sense. They work synergistically, right? So that it can make it all that much better rather than hitting it the nail with the same hammer each time. Now, as understood, and as you had mentioned, side effects, right? With every medicine you take, there's no free lunch. There is no medicine, to my knowledge, that has absolutely no side effects. Can you, and obviously these different classes are going to have different side effects, but can you give us an understanding as to what kind of side effects are at least expected or can be expected from these various regimens?
Yes, absolutely. And I'm quick to point out to my patients that come see me that any medication that has an effect also has a potential for a side effect. And so, as we mentioned, high blood pressure in and of itself does not cause symptoms until it gets extremely high or has been out of control for a while. But we start people on medicines that have high blood pressure. And when that blood pressure starts to lower, many times our body has reached a set point where it's kind of gotten used to the blood pressure being high. And so when the blood pressure starts dropping back down to the normal range, one of the most common things that people will tell me is they feel a little fatigued, a little draggy for a brief period of time. And that's almost uniformly a transient thing that occurs over 3 or 4 weeks and then resolves, because the body resets its point and it gets used to, okay, now we're normal again, and I'm used to that, and it's not making me feel bad. Probably the more precipitous one would be if you stand up from a chair too quickly, getting lightheaded. We call that orthostatic lightheadedness. And some people it can drop enough that they actually may faint from that. That doesn't happen all that commonly, but it can occur. And especially in our older patients, it's something that we worry about in terms of falls and things of that nature. But really, most of the time, the side effects of the medicines are very low. The ACE inhibitors and the angiotensin receptor blockers sometimes can cause certain people to develop hives. And so we have to be a little careful about that. And then depending on the exact class of medications that we utilize in the blocker categories, those can sometimes cause people to wheeze, or sometimes cause people to feel a little constipated, sometimes cause people to feel a little bit more lightheaded. And then in that blocker group especially, we can sometimes see erectile dysfunction in those classes of medications.
That's a good point, especially for the guys out there who say, where did this come from all of a sudden? But you say, so it's kind of like, it's screwed if you do, screwed if you don't, right? The high blood pressure is going to also potentially cause erectile dysfunction as well. So it's not like you're going to stop your medicine and all of a sudden get better. That's for sure. Would you say that, obviously it's a mixed bag there, all these different drugs have different side effects. Would you say that some are tolerated better than others? Or does it just depend on the person?
And part of the reason that we do start with the diuretics is they tend to be extremely well tolerated by most, as do the ACEs and ARBs. They're well tolerated by most. So most of the time, we're going to start with those classes of medicines in the vast majority of people. Calcium channel blockers have a little less side effect than the beta blocker and the alpha blocker class. The biggest one with the calcium channel blockers is that in addition to sometimes some constipation that can occur with calcium channel blockers, some people who are prone to reflux of the esophagus in terms of acid reflux. Sometimes calcium channel blockers can make that a little worse as well.
Got it. So it sounds like it's not like a purely algorithmic type of situation where it's like, choose your own adventure. It's like it's a little bit of art there, right? To mixing, having the right mix based on your patient and kind of what their other predispositions are, it sounds like.
Absolutely true. And as I say, thankfully, as we have altered the way we approach things with small doses of multiple medications, I'm seeing these side effects fewer and fewer times these days. So I think it's a good strategy that way too.
And so I'm going to use a football analogy, I guess. So like, in football, what's a win, right? You have the end zone, you're crossing the end zone, touchdown, 6 points, go for the point after, right? Is blood pressure the same? And what I mean by that is, you go through these lifestyle changes, you go through medication. Is our end zone 120/80 always? Or is this more of a continuum as well?
I will say that our goal line, yes, is getting our blood pressure equal to or less than 120/80, and that's what we shoot for. We know that we reduce stroke rate quite significantly with that. We reduce heart attack rate quite significantly by doing that. But there are factors that come into play depending on side effects, and there are individual variances in that. There are some people that we put on medications, and if I try to get their blood pressure most of the time at 120/80 or less, then I'm also going to cause them a lot of other times where they're feeling that lightheadedness or feeling faint when they stand up. And so in that case, if I have to let it run a little bit higher on average, we can live with that. And we do know that the risk is certainly better being close. Maybe it's akin to kicking a field goal as opposed to scoring the touchdown.
Right, you got to put some points on the board, man.
That's right.
I get
That's
it.
right.
I get it. Now, with this, we talked about a lot of scary things that high blood pressure can cause, from kidneys to eyes to the heart to the brain, etc. Once that blood pressure is up to that level, are those problems irreversible, or is it to some extent that they are, or is it somewhere in between where some damage is done but you're preventing more damage from occurring? Which bucket would you say this falls in?
Yeah, I would say from the standpoint of the changes that we see in the kidneys and the eyes, I don't know that those are going to get better, but you can prevent them from progressing. So that's what we're going to look at more than anything else. All right, we've got a little damage there, but everything's still working. Let's prevent further damage by keeping the blood pressure under control. There's definitely a continuum as it pertains to stroke and heart disease and many of those other complications that we described, that would show us that over time we still do have a consistently elevated risk, albeit with gradation. So the closer we can get to normal, the better. And there are some cases, I do think, especially with the heart, if it becomes stiff from high blood pressure, I do think we can see the heart remodel itself over time and actually work better as we move forward. But again, with the eyes and the kidneys, in most cases, we're just trying to prevent it from progressing further.
Got it. Now, we talked about getting wins and touchdowns and field goals. What if we can't get any points on the board? What if we're on these medications and we're mixing them up and the blood pressure is just not budging? What then?
Yeah, and in many times once that occurs, that may be the point where we thought this was just, pardon the quote, but plain Jane high blood pressure, what we call essential hypertension. But many times that may not be the case. And many times, if we're using good doses of medicines, people are truly following through with the lifestyle, they've got their sleep apnea treated if they've got that, and still running high blood pressure, that may be the time that we start a secondary workup where we look harder. We look at kidney arteries to make sure there's no narrowing there. We look at various hormones that may be circulating at a higher level in the body than what they should be. And so that may warrant a little bit of a secondary survey for us to see if there's something that we could be missing that could be thwarting the normal attempts that we make at lowering blood pressure from being effective.
Got it. And, one thing guys are thinking about is like, okay, Dr. Erwin, I get it. I need to take some medicine and get things better. But is this a permanent solution? Like, am I going to be on these medicines the rest of my life? Or is this like taking an antibiotic where, you give me it for a week, everything gets better and I'm back on the road again? What are your thoughts on that?
I think that from the standpoint of being able to come off the medicines, I do have people that eventually come off of their medicines. Typically, those are people who are carrying a lot of weight, maybe haven't followed through on a lot of the other lifestyle things that we've mentioned, and we can work on those further over time. And if somebody loses enough weight, gets their exercise tolerance to the right place, there could be times down the line that we can try to remove the blood pressure medicine and see if that blood pressure is going to stay within the normal range. I would really encourage people not to do that on their own, to do it only with your doctor. Let them know if you've stopped your medicine. They're going to understand, that this happens a lot. We know that up to 60% of people that start blood pressure medicines, if I check on them at a year and they really are supposed to still be on those medicines, about 60% of people aren't taking them, at least not taking them fully as prescribed. And so it's not worthwhile. Your doctor should be your partner in this, and talk to them, tell them. And if there's a reason why you stop, then maybe there's a different regimen that we can take towards that, or at least let that doctor be able to follow and check your blood pressure on a more frequent basis and determine, hey, all right, I'm willing to give you this shot for a little bit to try to keep it down, but if we start seeing it rise again, or if it's staying elevated, we may need to go back on these medications. And I think the take-home point with this, none of us like to take medications. None of us do, and doctors included. We don't like taking medicines either. But I think if we look at all the bad things that high blood pressure causes for people, and we think about it in a cancer analogy, and I said, I have these medicines that I know that if you take them and we control this risk factor, I can prevent you from getting cancer in 10 or 15 years. Will you take this pill? Most of us would take that pill if we knew we were going to get cancer in 10 or 15 years if we didn't take it. We can think of the blood pressure the same way. When somebody runs high blood pressure, it's not a if, it's a when something's going to happen down the line. Is it our dementia when we're really old? Or is it something that happens before that cuts our lifestyle or our function short? A stroke, a heart attack, erectile dysfunction, all these things that we want to avoid. They're going to happen with prolonged hypertension. So work with your doctor. If you're ever finding a need to stop your medicine, make sure that your doctor knows and is partnering with you and can follow along with you.
That's such a good point, because again, on the urology side, if I had $1 for every time I heard about my blood pressure medicines causing erectile dysfunction, because sometimes it is, but the problem, and this is where the key is, talk to your doctor. The assumption that a lot of guys make is that all blood pressure medicines will cause erectile dysfunction. So they just stop it rather than telling the doctor. First of all, they might be embarrassed to tell the doctor about their erectile dysfunction. And that's why they come into the urologist looking for Viagra, rather than actually saying, what if we change your blood pressure medicine around, right? And maybe that will potentially impact it less. One final question for you. Again, we started the conversation about checking blood pressure routinely. Once you have guys on a regimen of medication or lifestyle or some combination thereof, how often does it make sense for them to check their blood pressure, especially now that they're, let's say, on medication?
I think that once we've gotten blood pressure stabilized and controlled, probably still checking it somewhere between 3 and 5 times a week would be a good idea. And keeping a blood pressure log is important. There are apps that you can have on your phone now that you can actually share with your doctor's office, or you can just do it as simply as writing it down on a pad of paper, so that when you go in to see the doctor the next time, you can show them what the ranges have been. And it's not an uncommon scenario, and a good reason to keep the logbook, that when somebody comes in to see me, I'm a heart doctor, and maybe they equate me with the time they actually had their heart attack, and I was in the ICU with them. So I may make that patient a little stressful just remembering what happened at that time. Sure. And so if I see a high blood pressure in the office, it may be inadvertently high. And if they're getting regular blood pressures that they're doing at home on their own, and those are all normal, then typically what I'm going to do is have them bring their blood pressure cuff into the office and let me check theirs against mine to make sure we're all calibrated properly. And if that's the case, and I'm seeing the same readings on their home cuff and on my cuff in the office, I can go by what they're getting at home, and I may not necessarily have to over-treat their blood pressure on the basis of 1 or 2 high readings in my office when they're stressed about something else.
Such a good point. Dr. Erwin, thank you so much. This has been extremely helpful. I know I learned a lot, and to all the guys out there in terms of kind of the importance of managing blood pressure, and even equally as importantly, how to do it. Before we leave you, we're going to ask you a question completely unrelated to blood pressure, I promise, or even cardiology for that matter. You know, the name of this podcast is Better Man Clinics, and the whole idea is trying to get to your best life, right? And so everyone we interview here has reached a pretty significant level of success in their lives, personally and professionally. And we always like to get some advice. This is some advice where we can get without any kind of medical legal issues, right? In terms of, how do you live your best life? What is the secret to your success?
You know, I tell my patients you can't be completely well unless you're well, mind, body, and soul. We're all interconnected beings, and I think it's important that we pay attention to all three of those aspects very closely. Most of us men grew up in a culture where we told to pull ourselves up by our bootstraps and just, man up, if you will. Well, that's not always the case. We need help. We need to be able to be frank and have a good group of supporting cast around us, friends and family and significant others that can help to pull us through, because we're all going to have rough times. But taking parts of your week to focus on what you're doing for your body, for your mind, and for your soul, I think are very important in terms of truly being well.
It's some great words to live by. Dr. Erwin, thank you so much. And to everyone out there listening and watching, thank you for joining us again. And remember our mantra here at Better Man Clinics: your best life is a journey and not a destination, and use every single day to just get a little bit better. We'll see you all guys next time.